Hey everybody, we're here at Digital Health Northwest, and I'm here today with Dr. Heather Evans and Yimei Xu, and we're going to talk about glass medicine, which is known on Twitter and Facebook and everywhere in the universe as a hashtag GlassMed. We've all been working with glass for about a month now, and we're going to talk about the projects that we've got underway. And I'll start with Yimei, who's really out of the gate. And Yimei, what are you doing with GlassMed these days?
Right now I'm experimenting with using it in my office. I'm a nurse and a therapist, and when I see clients, this actually helps a lot with my office flow. Probably the next thing I'm going to be experimenting with is putting de-identified patient information onto Evernote slides and being able to access the information while I'm actually with a client, of course, with their permission.
And Heather, what are you working on these days? I know that you've done some experimentation in the OR suite, not with patients, I should say that right off the bat, but you've got some ideas about how glass can be used in the OR. Do you want to talk a little bit about that?
Yeah, I think what's really exciting to me is this idea of intraoperative emergency consultation for surgeons. I think that's the ultimate GlassMed app that I'd really like to try and develop. And what I envision would be that perhaps you're in the middle of a very difficult operation, perhaps it's inconvenient for one of your partners to come in to help, or it's something that you've never seen before and you want to get someone with a lot of experience in this particular problem right in your field of vision, able to see exactly what you see and experience exactly what you're experiencing in a real-time way. I think this has some amazing implications not only for improving patient care, but for personal coaching for surgeons in the future. And I'd really like to see us work on things that wouldn't require a lot of manipulation of glass in terms of development of apps, but using it just as it's intended in a novel way like that. Now, of course, you mentioned that I'm not using it with patients right now, and I want to make it clear that we have to be very respectful of the privacy laws and the security concerns that are really paramount and something that we just can't violate. So I have not been using glass in the operating room or even with my patients in the clinic or especially in the emergency room. I think that there's a very intense conversation that we need to have as healthcare providers and with our patients and the rest of the public before we really jump into some of those arenas.
I totally agree with you. Although we are experimenting not with patients, again, we're going to make that very clear, but we are experimenting with each other so we can start to develop the first generation of applications for the medical arena. One of the things that makes glass so powerful, in my humble opinion, is the ability to actually see through glass and to actually record and then slave it to a tablet or a phone or a telephone device, so people can actually see what you're doing on a third-party device, and that is something that's really extraordinary. Dr. Raphael Grossman is a pioneer in telemedicine, and he is one of the surgeons that has pioneered that particular technique. Again, that's using existing applications, just this first generation technology as it stands without any third-party intervention. So that's one novel application that is emerging from our experiments. One of the experiments that Yimei and I are currently engaged in is actually using glass as a potential therapeutic mechanism that could possibly teach emotional intelligence or teach communication in a better way. Yimei, do you want to talk a little bit about some of your ideas and how we are proceeding on this path?
Well, I got a little bit of an idea from some of the work that I have done over the last 13 years with couples and also with parents and children. Imagine when somebody like myself as a therapist works with people week after week, And what I do is try to reflect back to them as a mirror what it is that I'm seeing. We could make that time a little bit shorter by actually having a monitor filming through glass, of course, again, with the permission of the people in front of me, and then be able to show them what their faces actually look like, including all of their expressions that they have in their face. Now, we know that sometimes people actually say things and what shows up on their face is different or in contrast to what they're actually saying. So we're trying to get to the deeper feelings. And these feelings that are often suppressed are very strong negative emotions. So imagine if we could actually capture that, show people that, and then say, let's deal with that, how much faster their therapeutic process could be brought along.
That's fantastic. Thank you very much. Okay, Heather, you're actually starting to wear glass in a medical setting, and again, not around patients or not within a patient context, but how are people responding to glass as you are starting to use it throughout your day?
Well, I'm glad that you mentioned that I'm not wearing it at work. It's been a little hard for me because I've really wanted to, but I feel like I need to be very respectful of my patients. But when I do wear it at work with my colleagues and with my partners, there's been a lot of interest in it. And I think this is sort of a universal thing that people that are part of the Explorers program have experienced, that you feel like a rock star when you walk around because people just want to know about it. They want to touch it. They want to try it. And I think one of the greatest things that they provided with glass was this way to screencast, like you were talking about, with the phone. And I use that almost every day when I wear glass, because someone invariably will come up to me and say, "Oh, what is that? I've never seen that before." "Oh, is that Google Glass? How does that work? What do you do with it?" And I'm sure you've experienced that you kind of have to explain that it's in beta and there's not a lot that you can do with it yet, but boy, the things that you can do are really amazing. And so being able to screencast and show exactly what you're seeing and the pictures that you've just taken and the video that you've just taken, I think that's a really wonderful way to bring people into the experience. And I imagine that this is the way that we're going to be able to use this with our patients, that's how we're going to be able to bring people in and gain trust and be able to use this as part of our work.
Fantastic. And Ime, what is your experience? What is your experience like as you travel throughout your day? I might mention that Ime is training as a triathlete, and she has also used glass. We are all focused on health, wellness, fitness, and those are some of the target areas that we're particularly interested in seeing where glass will propagate. So, Ime, what has your experience been as you have worked within your fitness community and your triathlete community? How have people responded to you?
It's been overwhelmingly positive. What I thought it might be before I actually picked up my glass was that, we read a lot of things in the media that there would be some negative reactions, that maybe you get your nose punched, maybe somebody would try to rip it off or tell you we don't want that around. And I actually have not had that experience at all. What's been really fun as an amateur athlete is actually taking it out on some of the courses and people being not only curious about it, but seeing that later on as apps get developed for it in the fitness world, which I'm expecting that it definitely will, that like all of our other fitness tracking apps, all of our other health tracking apps, that this is going to become something very easily integrated, so much so that I actually put a little message on Google asking them, could I please have the yellow rose tinted glasses, the clip added on, because I love how this fits me perfectly for the Asian fit, but also because I know that I'm going to be taking it outside and track. Now, this isn't waterproof, so obviously I can't take it in the water, but I'm seeing how all the wearable tech is moving in this direction to basically go everywhere we do.
Yes, and I should also mention that Ime did the first stand-up paddleboard
in our group.
So she's cutting edge right out there. I'm looking forward to your looking at your bicycle feed as well, because she is training on her biking leg of her triathlete program as well.
It's a little bit jiggly sometimes, so I mean that's just because you're bouncing up and down on a bike or if you're running. But absolutely very comfortable, very lightweight. I can take it pretty much on all the shorter distances. I don't think I would do it on a longer one. And of course, the USTA does not allow heads-up displays, MP3s, or any other kind of wearable technology on the actual race courses. So those are banned.
So I'm not a triathlete, and I wouldn't even call myself necessarily an athlete, but I do a lot of biking with my family, and I've used glass with my kids and my mom and my husband biking down along Alaskan Way, and I was blown away with how wonderful a video was. It's really a lot of fun. And actually, I was kind of interviewing my mom as we were riding because she was telling us about Bertha. She had actually gone down to when it had been installed with the governor. And it was really fun because she knew a lot about the tunnel boring device, and we were driving right by it on our bikes. And so I was asking her, tell us, Mom, where exactly is it? And as we were riding, we were able to do this. So I think that really points out how great a device it is to be able to interact with people while you're doing something and record it at the same time. And it was so effortless. It wasn't dangerous. It wasn't like I was afraid I was going to fall off of my bike. I actually have used glass quite a bit while I've been driving, and I think that the driving directions that come through glass are so much better than the directions that you get on your phone, and so much safer because you're always keeping your eyes on the road, or at least up, and looking a little bit up to see the directions rather than looking down and missing everything that's going on around you. So I've really been impressed at how interactive you can be while you're still wearing glass. And I think it says something that, we've been sitting here talking for a number of minutes, and none of us have been distracted by glass, or it hasn't interrupted our conversation. So I think it is possible to have a wearable computer that doesn't interrupt your interactions with people and actually kind of enhances them. I was at the grocery store yesterday, and somebody asked me about it, and they were like, "Oh, do you find that it interferes with your interaction?" And I said, "No, actually, I feel like I talk to people more now because people come up to me all the time to ask me what it is." Yeah.
I also wanted to go ahead and discuss some of the applications that are the interfaces and applications that are already available on glass that people may not be aware of. There are alliance partnerships at this point in time with Facebook, with Twitter, with Path, also with the New York Times, with CNN, and Elle Magazine. So that's the first, and Lean In, which I was particularly thrilled about, to have a critical mass of women. I'm able to receive my Lean In notifications through glass and respond to them in real time. So Sheryl Sandberg, we love you for that. So I did want to give you a little bit of functionality of what we can do. We can email, we can text message, all using voice command, and with some manual commands as well. So it is voice activated, and it is also manual for inappropriate situations where speaking is not the best thing. Heather, what do you see glass in? How do you see glass evolving in the medical space in the next 5 years?
Well, I think if we're able to look past all of the privacy and security concerns that we're really going to have to deal with, and we're able to integrate this device into patient care and to empowering patients to care for themselves and interact more fully with their providers, I think I would envision that a patient could come into my office and they would be wearing glass, and they would ask if they could record our encounter so that they would be able to go home later and really relive all of the conversation that we had. They wouldn't go home and forget that I had counseled them that they were going to need to do certain things before and after surgery, or that they could expect that it would take a number of weeks for them to heal after an operation. And I think that that really would enrich the patient-provider interactions that we have in person so that they could be more long-lasting. As for the provider, I can imagine that there may be a way for providers to record their interactions with their patients, even a brief interaction. For example, if I went to go see one of my patients on postoperative day number 1 and I wanted to look at their wound and I wanted to see how they were feeling, I could record my very brief interaction with them and have that recording put in the medical record rather than taking the time to then, in addition to having that interaction, that meaningful time with the patient, also having to document it in typing it or in dictating it. I think that there's a lot that we can do with expanding the current medical records so that we can really capture more of what we do as providers and what patients can get from us in real time.
That is excellent suggestions. I know that with my medical provider, I have a MyChart. When I go in to see my provider, I can refer to that chart, but it's very rudimentary. It would be astonishing to be able to actually see a video of the interaction that we've just had. That would be amazing. Ime, what would you like to see happen within the next 5 years, or how do you see glass evolving in your space?
I'd like to follow up that, and I agree with everything that you're saying, and I'm like, bring it on. That's exactly where I'd want to go. But additionally, last year when I was at PII, which is a privacy and security and identity conference that's coming here in September again, one of the things we talked about was access. Really remembering that healthcare is about a conversation, a relationship between the healer and the person who's coming for healing. It's a collaboration to help somebody move from illness to wellness or stay in wellness and keep satisfying their goals to remain as well as they can in their station in life. And one of the things that I'd love to see happen is that every time those conversations come up in real time, you can send to that other person sitting across from you that information in real time, so they're not having to go, okay, when you get home, check this on your email, and that you have to, as a provider, remember to send that. You're doing it right there and then. You have pre-made templates of the most common information, and that could be instantly sent to them. They don't have to go through the UI of some website and go look for this resource or click on that link. You're just sending it to them directly. Could have everything from the reminders of all the medications and what they need to receive from that and what times they need to take it, all that information that gets lost usually in that critical teaching moment because the client's coming to you in a certain headspace. It could be emotional, there could be trauma involved, there could be all kinds of things going. You don't want them to forget that, but you want that moment with the client to be the most important.
I want to add something to that. I think that there's so much lack of standardization, particularly in surgery. We've been living in these private, silos, right? I mean, the operating room is probably the most private place that you can imagine. There's very limited access. I mean, my husband doesn't even know what I do. But I think that if we're able to open those doors, at least to each other as practitioners, to be able to share what it is that we're actually doing, how do we actually conduct our operations? Can we bring some more standardization to the way that we do things and really elevate our practice? And in addition to that, that gives us the time to really work on those times when things are not standard and really focus on those special cases where we really need our attention if we're all doing things the same way. And I think the same is true when you're interacting with the patient. So if I don't have to say the same thing every time, I can focus on what's different about this person. And I can give them the same information that I give to all of my patients, but I can really focus on what it is that they need to do to be able to get well, to be healthy, and to be able to get through something that's very traumatic and difficult and oftentimes, the scariest thing that someone has to go through in their life.
Now we're going to demonstrate how we can screencast through glass. I am actually going to take some pictures of Heather and Ime, and we will screencast through to my cell phone. This can also screencast through to a tablet device as well. This is how we can actually create an educational program using glass in medicine or in any other form as well. So the first thing that I'm going to do is I'm going to actually activate my glass by saying, "Okay, glass, record a video." Actually, I blew it. Sorry about that. Okay, so you'll have to, we got the first part. Okay. "Okay, glass, record a video." Now I'm right in the, as you can see, I've gotten off my seat, I've turned around, I am screencasting through to my cell phone device, and I am recording a video of Ime and Heather. So this is happening in real time through my cell phone, and again, this can also happen through a tablet at this point in time, and hopefully in the future we will also be able, this is one of my requests for functionality, is that we would be able to actually broadcast for an educational audience through Hangouts on air or through YouTube. So that it would be the kind of functionality that I would like to see come to the glass platform, hopefully within the near future. Okay, so we've just given you a little bit of a taste of what glass is capable of doing. This is, again, very rudimentary, first-generation technology, but it's extraordinarily promising. Any last thoughts, Heather?
I'm just really excited to be a part of the Explorers program. I was really bowled over when I got the tweet saying that I was going to be able to get glass, and it's been a lot of fun. I think it's been a lot more fun than frustrating, so I look forward to seeing what the next generation is going to bring.
Thank you very much. And Ime, any parting thoughts to our glass community?
Join, because the more the merrier. It becomes a giant party. You do not have to just be into Google. Of course, anything that you're interested in technology, there really is application and space for you to come and add your piece.
And I would like to say that I think the glass platform is extraordinary, and Google has done a remarkable job of rolling out this first generation tech and supporting us all. We currently have several communities that are burgeoning in the Seattle metropolitan area. We have the Seattle Glass Explorers on Google+. We also have the Seattle Through Glass community on Facebook, and we have the Lean In Glass Explorers community as well. So if you'd like to connect with any of us, you're welcome to do so on those platforms. I'm Jairus Miller, and thank you very much for joining us.